Hi, everyone. Welcome to Emergency Medicine Research Associates Fall 2021 Recruitment Information Session video presentation. My name is Akil Paladugu, and I'm currently the head coordinator of EMRA. And I just wanted to say thank you to all the applicants that are taking the time to view this recording and are taking that initial step to really assess what our organization can offer you as a potential pre-med or pre-healthcare student. And I just want to say that hopefully after watching this recording, you're able to get a sense of, why this organization is something you might be interested in. And with that, I want to emphasize that this recording is to be used in conjunction with our live Q&A information sessions on October 7th and October 8th from 6 to 7 p.m. Pacific Standard Time on Zoom. So our hope is that you would view this recording and then reflect upon what you've already learned about our organization, see what points and what areas you can hopefully find for areas of clarification, and then come to those info sessions ready to ask questions and get your answers. So the first thing I want to talk about with regards to EMRA is exploring why we exist in the first place. So we have a quote placed here that says, the single largest impediment to prospective EM clinical research is the ability to collect data. You might be wondering how this quote answers the question that's posed. So let's break it down. In prospective studies, individuals are followed over time, and data about them is collected as their characteristics or circumstances change. The advantages of prospective clinical research include the minimization of bias and confounding variable effects. But one of the main difficulties surrounding it is that it is often extremely time intensive and adds a lot of extra responsibility for physicians and ED staff who are usually focused on prioritizing patient care. This is where EMRA's role stems from. EMRA has helped to alleviate some of the burden from the ED staff by identifying, consenting, and enrolling patients for selective emergency medicine studies. And the next thing to cover is our program's vision, which is to advance the practice of emergency medicine through clinical research. Specifically through serving our very important role in screening, consenting, and enrolling patients in clinical trials, we hope to play our part in progressing clinical research that can genuinely benefit both patients and providers. Additionally, our mission is to assist with ED faculty-conducted clinical research studies and provide volunteers with educational opportunities for professional development. I like to really characterize EMRA's relationship with the ED staff as mutualistic, in which the ED staff benefits by having some of their study responsibilities handed over to EMRA's, and while EMRA's benefit from unparalleled exposure to some of the top level 1 trauma centers, as well as the opportunity to form relationships with renowned healthcare professionals. And on that topic of renowned healthcare professionals, I want to kind of expose you guys to some of our EMRA faculty sponsors. One of the highlights of this program is our relationship with these sponsors and other residents and fellows in the ED. Our close relationship really allows us to gain mentorship experiences as well as research projects to help continue the growth of the program. So just a brief introduction on the 4 faculty sponsors presented on this slide. We'll start with Dr. Maurer, who is the original founder of EMRA and is the principal investigator of the abdominal pelvic CT study. We have Dr. Hendy, who is the ED department chair. He actually is the principal investigator of the Clover study. We then have Dr. Cooper, who is the faculty sponsor we work most closely with as our program. She's very, very invested in ensuring that this program offers its members a truly, truly enriching experience. And with that comes, a very, very unparalleled effort on her end to make sure that, we're getting the guest speakers we need, getting opportunities outside of what's normally offered to EMRA's and clinical research experiences to really progress the organization into something that is always ever evolving and really graduates the next, generation of healthcare professionals that are ready to serve. And then we have Dr. Schreiger, who is the vice chair of the emergency department, and he just helps around with many of our clinical research studies. So now that we've talked a little bit about our faculty, let's talk a little bit about who we are as an organization. EMRA is a team of 30 to 40 volunteers who serve as the dedicated eyes and ears of UCLA's emergency department and the clinical research division specifically. Traditionally, we operate both in the ED as well as a separate office on the 8th floor of the hospital from 8 a.m. to midnight, 7 days a week. And on those shifts, we're screening, consenting, and enrolling patients in clinical studies. To me, EMRA is the most valuable organization I've joined as a pre-med on campus because you not only get an in-depth look at emergency medicine and clinical research, but you also get to take part in our committees and join a greater community of like minded individuals with the same passion as you. Now that I've told you a little bit about who we are as an organization, my fellow coordinator Shivam will explain to you what we're not.
Thank you, Akhil. So as EMRAs, we are very fortunate to have many opportunities and responsibilities within our program. And though we are afforded access to the Ronald Reagan Medical Center and the emergency department there, it's important to note that we are not healthcare professionals, and as such, our activities cannot infringe upon aspects of patient care. We are not healthcare providers, and thus we do not provide any medical advice, nor do we make any physical contact with the patients in the emergency department. Additionally, we are lucky to work with many research experts. However, we ourselves are not research experts. Due to the intensive nature of the research that is conducted, we do not generally engage in data interpretation and analysis. And with that said, EMRA, however, still does offer multiple opportunities for clinical exposure and research as our faculty, sponsors, and staff clinical research team understand and heavily support the research associate involvement whenever applicable. So now I'll spend some time covering our duties as EMRAs. EMRA plays a critical role in the execution of ongoing clinical research at Ronald Reagan. And we are given the opportunity to engage in a unique form of research that allows us to not only gain knowledge on research proceedings, but also gain patient exposure. Broadly speaking, most of our studies involve the following responsibilities. We are going to be screening for qualifying patients. We'll end up communicating with healthcare staff, assisting in obtaining informed consent from patients. And for some studies, we do also end up collecting some data. Patient screening allows us to use our knowledge and the study at hand to look for qualifying patients and eventually approach physicians to move forward with patient consent. Although specific EMRA duties are dependent on the individual study, the aforementioned responsibilities to some degree are universal across most clinical research settings, whether it be academia or industry. Consenting and enrolling is always an important part of clinical research, and it is this process that protects patient rights. As EMRAs, the opportunity to integrate yourself into the emergency department as a contributing member of a large research team, you learn many skills that can be carried forward into a future in healthcare. So now I want to go a little bit over the EMRA experience, and I'm sure you all are wondering what EMRA has to offer to you as a potential member. So here are some components of what we call the EMRA experience under normal circumstances. Exposure to clinical research, shadowing, observational opportunities in the emergency department is what typically appeals to most of our applicants. Our typical shifts are 4-hour clinical shifts, clinical shifts with an additional 2-hour clerical shift. Moreover, I believe it's very important to emphasize that EMRA strives to do more and continually grow. Our organization is good, in my opinion, because it is an open platform for members to grow and pursue different endeavors through our committees. As you can see, we offer a wide range of other resources that also help serve our members. And a few include the emergency medicine conferences, physician mentorship opportunities, and I cannot emphasize this last point enough, but amazing, helpful peers who share a passion for healthcare and medicine and are always looking to find new ways to help each other out. And obviously, I would be remiss if I didn't talk about the COVID experience. COVID has undoubtedly reshaped our operations as an organization, and therefore we have had to adjust our program since volunteering in the emergency department is not feasible for the time being. Our fall EMRA experience will involve in-person general meetings, which will be for 2 hours, and in some occasions will be followed by exciting socials. Additionally, our program is beginning the process to potentially transition back into a remote location and continue our clinical research responsibilities from that location. And similar to previous quarters, emergency medicine conferences, physician mentorship opportunities, and other pre-med resources will still be available. Lastly, we will still be very active within our committees, which we will discuss to a greater extent later in this presentation. For now, I will pass it over to Lorenzo, who will talk about our studies.
After having given an overview of the program and what it is we do, we would now like to highlight some of our previous completed studies to give a better idea of the kind of research performed in the ED that we get to work on, as well as to let you consider whether this is something you can see yourself doing. The first study is pediatric pulse oximetry variation between respiratory diseases, better known by EMRAs as PEDS-02. PEDS-02 is a data collection study designed to identify what should be considered normal and abnormal levels of oxygen saturation in pediatric patients. Next is outpatient venous thromboembolism management, or VTE. It investigated antithrombotics with patients with VTE deemed to be low risk, assessing the viability of oral medications in an outpatient setting compared to heparin injections. Whole blood investigated different types of transfusion therapies in the acute trauma setting in order to determine which one was the most efficacious. This study gave EMRAs the opportunity to follow patients into the OR, and some members were also allowed to use the thromboelastography machine to test the blood samples, shown in the picture on the far right. Finally, the study on the syncope rule was designed to test the efficacy of using a mnemonic called CHESS to determine the risk for serious outcomes at 7 days in patients presenting with syncope or a loss of consciousness. It ultimately validated the syncope rule, but found that it was less sensitive and specific than initially reported. EMRA was acknowledged and thanked in the final paper, which is an exciting recognition of our contribution to the study. And now that you've heard about what we have done in the past, let's cover some of our current and upcoming studies. First up is one of our longest running studies, crystalloid liberal or vasopressors, early resuscitation in sepsis, or CLOVERS. The purpose of this study is to compare two treatment options to treat low blood pressure in patients diagnosed with sepsis, which is a full body overreaction by the immune and inflammatory system to a bacterial or fungal infection. The two treatment plans being evaluated are a primarily fluids-based approach and a primarily vasopressor or blood pressure raising approach. Because sepsis is a condition that can often lead to organ failure and death, the primary outcome being evaluated is a 90-day in-hospital mortality rate. Sepsis is a complex condition and is a leading cause of death in US hospitals and worldwide. So the CLOVER study, in effect, is looking to create a standard of care for patients that could save countless lives. For CLOVERS, EMRAs are responsible for screening and enrolling patients into one of the study's two arms, either the fluid liberal or mainly vasopressor fluid restrictive approach. Accomplishing this requires constant communication with the patient care team, as well as closely tracking patients' vitals and fluid intake using Ronald Reagan's patient database. That's all for CLOVERS. I'll now pass it back off to Akil, who will talk to you all about the abdominal CT study.
So the abdominal pelvic CT study, or its longer form name, Developing a Decision Instrument to Guide Selective Abdominal Pelvic Imaging of Blunt Trauma Patients, is a very interesting study that EMRAs get the chance to participate in. So the purpose of the study essentially is to assess and determine criteria for when blunt trauma patients truly necessitate an abdominal pelvic CT. And the reason why we want to form this criteria is because abdominal pelvic CTs are known to have the highest effective radiation dosage of all CT imaging, which, for a patient that may not need this imaging, could put them at risk of inadvertent harm through the excess radiation exposure. And a perk of EMRA participating in this study is that on shift as an EMRA under normal circumstances, you get the opportunity to watch every trauma resuscitation that enters the ED during your shift. And now I'll hand it off to Haiti, who will take you through the MI study.
So the myocardial infarction study, or the MI study, investigates the potential correlations between Netrin-1/DCC signaling and the nature of myocardial infarctions in patients. Netrin-1 is a protein that is currently being investigated by the Chi Lab at UCLA as a biomarker that has a potential role in reducing ischemia-reperfusion-induced infarct size. This study is unique because it provides EMRAs a novel perspective on the nature of clinical research, because the trial involves the ongoing collaboration between the emergency department, EMRAs, and the Chi Lab. EMRA's role in the study includes monitoring STEMI patients, responding to STEMI pages, obtaining blood samples drawn by qualified hospital personnel, and transporting and handing off samples to the Chi Lab staff. The MI study allows EMRAs to play a critical role in one of the most foremost examples of translational medicine and innovation at UCLA. That's it for me. I'll hand it off to Grace for an explanation of Impala.
Thanks, Haiti. I will be explaining our Impala study, also known as Emergency Medicine Palliative Care Access. Palliative care you might have heard of, and you might associate it with an older population. And that's true because half of older Americans end up visiting the emergency department in their last month of life. And so a lot of research now is looking into the benefits of palliative care, and more specifically, palliative care that is administered in the emergency department, which is right up our alley. So emergency medicine initiated palliative care has been shown to improve patient outcomes in older adults with serious life-limiting illnesses. However, we're not quite sure, the optimal modality for providing such interventions. So Impala is trying to fix that knowledge gap, which is a 2-arm, multi-site randomized controlled trial that seeks to investigate how different forms of palliative care, such as nurse-led telephonic care versus going in person to visit an outpatient clinic, how that can relieve both patient and caregiver burdens and outcomes. And next, I'm going to turn it back to Lorenzo for our ICECAP study.
ICECAP, or Influence of Cooling Duration on Efficacy in Cardiac Arrest Patients, is one of our newer studies, introduced since our departure from the ED in early 2020. As the name suggests, the population of interest for this study is patients who have suffered cardiac arrests, more specifically those who suffer one outside the hospital and arrive in a comatose state. While these patients are comatose, the blood and oxygen supply to their brain is decreased, which puts them at risk of suffering brain damage. In order to combat this, it has been suggested that cooling down patients to levels below hypothermia could help. ICECAP seeks not only to determine whether cooling patients is superior to not cooling them, but also to calculate the optimal amount of time patients should be cooled in order to gain its benefits without exposing patients to risks related to hypothermia for longer than necessary. EMRA's role in the study is to screen for incoming cardiac arrest patients and notify the patient's care team that they qualify for the study so that they can be enrolled and have their treatment plan adjusted accordingly. That's all for ICECAP. Up next is Tim, who will cover the fentanyl study.
Thanks, Lorenzo. Hi, I'm Tim, the study head of the fentanyl study. So fentanyl, the long name, is predicting medical consequences of novel fentanyl analog overdose using toxic. This is a multi-center observational study that analyzes fentanyl overdose in the ED. Fentanyl is a powerful opioid, and its analogs, otherwise called fentanylogs, are unregulated and heavily abused, leading to overdose. Since the number of drug overdose from these novel psychoactive substances have increased the past few years, the study aims to identify and quantify the intake of fentanyl among patients presenting with an overdose to the emergency department, along with evaluating the consequences of fentanyl overdose and geolocating any trends regarding this outbreak. The role of EMRAs is to screen for patients with relevant chief complaints and identify patients through their blood samples who present to the ED with psychoactive substance overdose. We will then also immediately alert the principal investigator, Dr. Levine, who will enroll the patient. And this is a fairly new study, but we're looking forward to getting it started in Ronald Reagan soon. Now I'll be handing it off to Julia to talk about our upcoming studies.
Hi everyone, thank you, Tim. I am Julie and I'm thrilled to be heading ASTER, which is our next upcoming trial. ASTER is an interventional controlled trial enrolling critically ill septic patients in the ED. So this study is to compare the efficacy of an acetaminophen infusion, aka Tylenol, versus a vitamin C intravenous infusion for minimizing organ failure and extending days alive in critically ill septic patients with major organ failure. So UCLA is one of multiple major research universities that is taking part in this trial, and we're currently working on getting Ronald Reagan set up as an ASTER enrolling site. EMRAs will be involved in screening septic patients who have a prognosis that's compatible with the goals of this trial, and then working with our staff research associates, our SRAs, and the pedal network at UCLA to get these patients enrolled in the ASTER trial arm interventions. Next, I'm going to pass it off to Haiti, who's going to start talking about our committees.
Thanks, Julia. So I'll be kicking off the discussion that we'll have about some of the committees we have with the research committee, which is the committee I'm the head of. So the research committee is one of EMRA's oldest and earliest committees, and it focuses on providing a space for EMRA members to further their knowledge of clinical research and discuss topics they're interested in. At the heart of the research committee is our journal clubs, which we hold around 4 times per quarter. Here, members present recently published papers about any topic in clinical research that they are interested in. And as a group, we discuss the paper's methods and their findings, as well as its limitations. We also have other opportunities for members throughout the year, such as presentations at UCLA's Undergraduate Research Week poster day. And we're also currently in the process of writing a literature review for future publication, which is really exciting. Overall, the research committee is just a place for growth and development of EMRA's research knowledge, and it's a great place to talk about what you're passionate about in medicine. So I'll hand it back to Tim for the new member training committee.
Thanks, Haiti. The training committee serves to equip the new members with the knowledge and skills to function independently on the clinical research shifts in Ronald Reagan. So after every recruitment cycle in person, we gather experienced members, volunteers to volunteer as trainers for these new trainees, and they teach the skills needed on shift, such as screening and enrolling patients, and they test their knowledge and performance of our study protocols. The time commitment is to be a member. The time commitment, if you're a member of the new member training committee, is usually weekly meetings, and these training shifts will also occur during a weekly 4-hour shift in the hospital, along with a quarterly meeting for training orientation. The overall goal of this new member training committee is to standardize and streamline this training process, and so that each member has a quality and equal training experience to adequately prepare them for life in the hospital. Now I will hand it off to Julia to talk about mentorship committee.
Thanks, Tim. So mentorship committee is the largest EMRA committee and is probably the one that's changed the most during COVID. Mentorship committee started out with simply pairing up younger EMRAs with senior members in mentor-mentee pairings every quarter. And then we eventually expanded to alumni mentorship pairings as well with some of our EMRAs who've graduated and gone on to medical school or residency. However, mentorship has grown a lot over the years and now encompasses a variety of different professional and personal development resources, workshops, and opportunities for EMRA members. MC really seeks to facilitate a greater connection with the physicians at Ronald Reagan through a couple different avenues, such as the shadowing shifts and the EM conferences that we've already mentioned in this presentation, and then most recently, a resident EMRA mentorship pairing program. So mentorship committee also puts on a variety of seasonal programming throughout the year and workshops throughout the academic year. So for example, we've had the MCAT prep workshop. We're having a Women in Medicine seminar with some of our amazing female EM physicians at Ronald Reagan coming up this quarter. We have case competitions every quarter, an AMCAS workshop every single year for the members who end up applying to medical school and more. So this is just a summary of some of the resources that we offer, but it's changing every year. And our ultimate goal is to both foster a greater connection between our members and with the ED itself, and to just grow them in their strengths and professional aspirations. We want all our EMRAs to be well-educated, well-informed, and well-rounded in all facets of their pre-med journey. And we're really excited to be providing these resources. Next, I'll head it over to Vi for Marketing Committee.
Thank you, Julia. So our marketing committee is actually one of our newer committees. It was created about a year ago to not only boost our relationship with the UCLA student body, as well as enhance our social platform, but also to offer our members an opportunity to really use their creative and organizational skills, as well as their past experiences to craft the portrayal of EMRA's vision. One of our primary goals while sort of establishing this committee was really to facilitate creativity in a low stress environment. A few of the examples of the projects our committee members have been working on this past year include the EMRA t-shirt, which really gave our members an opportunity to rep their commitment to EMRA publicly, as well as the infographic series highlighting our different committees and studies, and additionally collaborations and partnerships with other pre-med organizations on campus to really create a collaborative and engaging environment. And over the next few weeks, our marketing committee will also be working to put out some important recruitment information on our social media, so be sure to check that out. Additionally, the time commitment for this committee is largely project-based. Since this is a new committee, we are always welcoming new ideas and initiatives, and it really is how much you put into the committee, and it'll translate to what you want to get out of it. Next, I will hand it over to Emmy, who's going to talk about the Education Committee.
Hi, everyone. My name is Emmy. I'm the Education Coord. And to talk about the Education Committee, the purpose of it is to oversee a variety of opportunities and projects that members are able to pitch themselves. So it's facilitated by the emergency department, but it's developed and executed by committee members. Sometimes this involves helping shape the projects into ideas that can be feasibly implemented by the members, but most of the time it's just a pitching scenario. And every quarter, members have the opportunity to pitch their projects ideas to the entire committee. In the past, these have included a fully fleshed out resource bank for students on campus, a COVID demystifying social media initiative, and professional events for pre-health underclassmen on campus. There are about 2 to 3 projects chosen to be carried out per quarter and many opportunities for leadership in these specific areas of interest. In terms of member presentations, we also facilitate member presentations at general meetings, and this is where members are able to share with the rest of the org something they're extremely interested in or have like valuable experience with. It is a good way to gain exposure to the interests and involvements of other members, and everybody kind of enjoys giving their presentations. In terms of time commitment, we do not have scheduled meetings, but members choose how much time they want to devote to their projects and essentially schedule their own meetings with their own team. They're able to choose what commitment they want, which is what makes this committee slightly different. Next, I want to talk about what we look for in EMRAs. And to start off, I want to say that we seek individuals who are passionate about medicine and healthcare, about the research we do in the hospital, and about the specifics of our program that make us stand out from other organizations on campus. We look for individuals who show this passion through their dedication to responsibilities they take on and through their dependability in those commitments. I'd also add that communicating effectively and conducting yourself professionally are essential not only to being a stellar member of this org, but also for our future careers. We also look for individuals who take on different opportunities to make the most of their experiences, who show attention to detail in the tasks that they take on, and ultimately those who make good judgment calls, whether they're inside or outside of the hospital. Next, I'm going to pass it over to Vi to talk about the time commitment.
Thank you, Emmy. So we know that many of our applicants have very busy schedules, and so we wanted to clearly outline what we expect from you throughout the year. So one of our main requirements is having a 1-year time commitment beginning at the completion of your training, and this includes all holidays and school breaks as well. In addition to this, looking into the weekly commitment, we would have 8 hours per week. 4 of those hours would be in the hospital, working in Ronald Reagan Medical Center and actively enrolling patients into our studies. In addition to that, we have a 2-hour clerical shift, which would require you catching up on paperwork and ensuring that all aspects of our EMRA role with regards to these clinical studies is fulfilled. This would also include monitoring the quality of our studies. And lastly, we dedicate about 2 hours per week, sort of staying up to date on the studies and ensuring that your understanding of the protocol is sound and making sure that any changes to the protocol are adequately comprehended. We also have 2 general meetings per quarter, which are about 2 to 3 hours long, and they include presentations and talks by our incredible guest speakers, in addition to updates regarding the progress of the studies, as well as committee projects and fun interactions with fellow members. And one of the most important things that we really do want to mention here is that since we do have so many incredible opportunities here, as mentioned earlier from our committees and our studies, you can participate in as many projects as you choose, starting from your own initiatives or piggybacking off of other projects as well, and sort of taking advantage of all the opportunities that EMRA has to offer to really grow professionally and personally. So a lot of it is how much you put your time into it. You will surely get out of it as much as you put in. Lastly, one thing that we do require of our members is taking on the summer shift. It is one of the requirements that we have in our time commitment. And so one way that you can sort of handle requiring the commitment of summer shift is working in blocks. You can have someone sort of cover for you over one half of the summer, but you have to make sure that you make up that time at some point, and you need to coordinate accordingly with that member that you're communicating with effectively. And lastly, we can't allow the deferral of admission to another quarter. So if you are accepted into EMRA, unfortunately cannot postpone that admission to the following quarter. Next, I will pass it back over to Emmy to discuss how you can get involved.
Thank you, Vi. Okay, so in terms of how you can get involved, I'd like to start by saying that we typically accept around 10 members, depending on the current size of the program that particular cycle. And this is in no way to make the program more exclusive or less accessible to students. It's because a lot of the resources that we offer are dependent on external factors. Our working together with the emergency department dictates how many members we can have that can be trained extensively to do the work that we do. And these accepted members are accepted into the program officially when they have been trained in the emergency department and have shown their ability to carry about the shift duties required of an EMRA. Also, reapplicants are highly encouraged. We look favorably at reapplicants as they have put in the time and effort to apply into our program, even if we were not able to accept them the first time. Next, I want to pass it off to Haiti to talk about the volunteer office requirements.
Yeah, so just some logistical things that the UCLA Health Volunteer Office requires of all of its programs. First of all, members are required to have an updated TB vaccination or a test within the past year. Also, if you're currently already a volunteer through another program affiliated with the volunteer office, so those are programs like Care Extenders or Stroke Team or CTSI, we ask that you get a reference letter from your program coordinator to make sure that you're in good standing with their program and also that they are okay with you being in more than one program at once. If you are in another program, you must have completed the minimum requirement for it before applying to EMRA. So usually they'll have like a minimum number of hours or a minimum duration of time that you have to be in that other program before you can apply to EMRA. And lastly, you must be at least 18 years old to apply for legal reasons. And I'll next pass it off back to Shivam, who's going to talk about our application process.
All right, thank you, Haiti. So as for our application process, our application will be available online on our website at midnight on the 8th of October. It will be open for 1 week and it will close on the 15th. Unfortunately, no late applications are going to be accepted, so please try your best to submit your application at least 30 minutes ahead of time. If you have any questions or concerns or significant obstacles regarding this application process, please let the coordinator team know and we will do our best to address these. On the second half of our slide, we have some changes to our application process. We do review our applications and our applicants holistically, and GPA is not a screening factor. For more information about the initial stages of the application process and the timeline, please email us or DM us on Instagram at UCLA EMRA. Now we're gonna hear more from Lorenzo, who's gonna discuss a little bit more about the application process.
Thank you, Shivam. Following the written application, applicants with the higher scores will undergo a primary interview over Zoom, which will take place the week of October 24th. Those selected for a primary interview must provide a transcript, headshot, resume, and at least one reference contact. The reference does not necessarily need to be from somebody working in medicine or STEM. However, it should be somebody you know from a work or academic environment. Those who score the highest on the primary interview will be selected to undergo a second round of virtual interviews, which will take place the following week, the week of October 30th. The format of the interview will be similar to that of the primary interview. However, it will be over a longer period of time in order for us to get to know applicants better on a more personal level. Deliberations over applicants will take place following their interview. The qualities we are looking for in applicants include an ability to share and reflect on meaningful life experiences, professionalism and interpersonal skills, and expressing how applicants see themselves benefiting from being involved in EMRA, as well as how EMRA would improve as a result of the applicant potentially joining the program. Previous clinical or research experience is not necessary at any point in the application process, and many of our members, both current and former, had neither prior to joining EMRA. This may seem like a daunting process. However, what we are really looking for are members who are thoughtful, capable of working effectively in a professional environment, and passionate about the work we do. That's all I have to share about the application process. Next, I'll give it over to Grace, who will cover how to keep up to date with us on social media.
Thanks, Lorenzo. This slide is short and sweet. We have a QR code for you that links to our website, our social page. If you do have Instagram, we do post regular updates as well as reminders as to when our info sessions are, or info session Q&A are for that matter, as well as when the application opens and when it will be due. But if you don't have Instagram, not to worry. We also have an email list that you can sign up on our website. But also if you just write down the dates that we mentioned during this video, as well as that are listed on our website, you'll be good to go. We don't anticipate changing them at all. So just make sure you keep up to date and mark the dates on your calendar. And next is Tim.
Thanks, Grace. So during the info session next week, we're going to be following a Q&A based off the questions that you submit. So you could use this URL to submit questions, and also feel free to submit questions to our MENNET, to our email, which is UCLA EMRA staff at mennet.ucla.edu. And we're looking forward to seeing you next week, and I'll pass it off to Akil.
And last but not least, we just want to say thank you to all the applicants that are taking the time to get to know our organization on such a deep level. I would say that watching this video really gives you a comprehensive overlook and outlook on what we are as an organization. And I'm hoping that through watching this video, you're able to find some aspect of our program that really interests you enough to motivate you to pursue the recruitment process for EMRA this quarter. At the end of the day, as much as you guys might be interested in our program, we as the leadership team are very, very excited to see the next wave of EMRAs join our program sometime this quarter. And we hope that those of you that are watching this video right now stick through the process without us, and we can see you at an interview, either a primary or secondary, and hopefully eventually in the program. So with that, take care and good luck on the process.